ako nag-umpisa manigarilyo. Tinikman ko, hanggang ngayon, hindi ko na mapigilan.
18 years old, nag-start ako mag-sigarilyo. College kasi kami noon sama sa barkada.
In the Philippines, just about anyone can buy, sell, or smoke a cigarette. For decades, cigarettes have been incredibly accessible and affordable.
Sa Amerika, pag bumili ka ng isang pack na sigarilyo, mga $4 200 pesos. Samantalang dito, noon 20 lang ang isang kaha.
Cigarette prices are so cheap, a pack used to cost less than a kilogram of rice. A stick can be bought for less than the price of cheap candy. Smoking is so prevalent that almost 3 out of 10 Filipinos smoke. Every hour, 10 Filipinos die due to tobacco-related diseases. Every year, 87,600 lives are lost due to smoking. The fight to reduce smoking in the country had not been easy.
I'm making a motion to for the Senate to take up the RH bill first, and I will present my amendments.
We're supposed to take up the sin tax bill.
1 minute suspension. Can I have 1 minute suspension?
Well, before the suspension, Mr. President, I have to place it on record. I object.
But in January 2013, Republic Act 10351, also known as the Sin Tax Law, took effect. This landmark law is seen as a major victory by health advocates because it aims to decrease consumption of tobacco and alcohol while raising more revenues for health programs.
There was a need to pass a tobacco tax reform because the previous system was really problematic. It imposed very low taxes on tobacco products, insignificant rates, and all these weaknesses provided for a system that is conducive to the tobacco industry and provided for an environment in which the Philippines has been recognized as having one of the lowest prices of cigarettes in the world.
Pushing for the passage of the Sin Tax Law in the Philippines was a collective effort by advocates from government agencies, international organizations, civil society, and health groups, all working together to achieve one goal. One of the groups that advocated the passage of the Sin Tax Law is the Southeast Asia Initiative on Tobacco Tax, or SIT project, a regional effort to institute effective tobacco tax increases and sustainable funding mechanisms.
Prior to the SIT project, there was no unified position among stakeholders on what should be included in the tobacco tax reform. Furthermore, the SEATCA project also provided research and media campaigns in order to support the tobacco tax reform.
It was a difficult battle with opposition from cigarette and alcohol manufacturers. Despite the challenges, the Sin Tax Bill was signed into law in December 2012. The law provides for a two-tiered tax structure that would annually increase the price of tobacco and alcohol products until 2017, after which a single tax rate will be implemented. 85% of the incremental revenues of the Sin Tax Law will go to the Department of Health, while 15% of the incremental revenues will go to the Department of Agriculture to support alternative livelihood programs for tobacco farmers. In 2013 alone, the government collected 51.2 billion in incremental revenues, a 50.7% increase over the original target of 33.95 billion.
This also made possible the upgrade of the Philippines to investment grade by the major credit rating agencies. With respect to public health, there was a significant increase in the budget of the Department of Health, a 57% increase over 2013 levels.
The additional budget from sin taxes will be used by the Department of Health to fund different health programs.
The biggest chunk will go to the National Health Insurance Program, medical assistance, followed by the enhancement of different health facilities. Other funds will go to the different prevention and control strategies, expanded program for immunization, and deployment of health human resources to far-flung areas.
In terms of bringing down the number of smokers in the country, A recent survey by the social weather stations in March 2014 showed that smoking amongst the poorest Filipinos has dropped from 38% in December 2012 to 25% in March 2014. Among the youth aged 18 to 24 years old, smoking has also decreased from 35% in 2012 to only 18% in 2014.
Dati, nung medyo mura pa yung sigarilyo, sa buong maghapon, nakakaisang kaha. Ngayon, medyo nagmahal. 10 stick na lang yung nagagawa ko maghapon.
Nabawasan po siya ng mga pagka tuwing maninigarilyo ko sa isang araw, minsan 5 beses, 6 na beses. Ngayon, 3 na lang talaga.
This will eventually lead to a decline as well or decrease in the number of risk factors associated with non-communicable diseases or lifestyle-related diseases.
But not all smokers could easily drop the habit. Others resorted to cutting down consumption or shifting to lower-priced brands.
Yung mga barkada ko po dati, yosin nila Marlboro. Ngayon po, dahil sa tumas na yun, dumoble, binaba din po nila yung kalidad ng nila, sigarilyo. Yung mas mura po.
Alongside raising tobacco prices, there's a need to raise people's awareness about the harms of smoking. The signing of the graphic health warning law in July 2014 is a major step forward in achieving this. Strong health promotion programs are also needed to protect those who are being lured to try smoking.
There are many ways wherein health promotion can really reduce tobacco use. One such thing is to really do health promotion among young people. We do not want newcomers, particularly 12-year-old, 13-year-old, 14 years old, to enter the pool of smokers in the country.
Health promotion can be used to prevent not only diseases from tobacco use, but other lifestyle-related diseases as well.
Health promotion ensures there will be behavior change towards health and wellness. In the field of non-communicable diseases, we are now getting more deaths from heart disease, from cardiovascular diseases like hypertension, and coupled with that, diabetes, and also kidney diseases.
In the case of Thailand, they were able to develop powerful campaigns through the creation of the Thai Health Promotion Foundation.
Think of a child entering school, whether this is preschool, kindergarten, or even grade 1. This child would be subjected to a barrage of what we call non-healthy behaviors. It may mean eating junk foods, going to fast food, shunning away from vegetables and fruits. We need to constantly remind this child throughout his or her development. If health promotion is only for a day, only for a week, then that is not sustainable. We need sustainable mechanism for health promotion programs to empower the people to be responsible for their own health. We have taken the first crucial steps towards the right direction. We hope that the country continues to move forward to ensure the health of all Filipinos.